Hey, it's Dr. Jerry Williams with Urgent Care 24/7. Here to talk to you about an interesting topic, actually, something you won't read a lot about, something that the medical providers, the medical industry doesn't talk enough about, I don't think, and it's problems or complications with tattoos. Kind of an interesting topic. So, if you've got a tattoo, I actually happen to have a tattoo. I have a very cool Theodore Roosevelt tattoo right here on my arm. I'm very proud of it. Amazing work of art done by an amazing artist. So if you have a tattoo and you've got a problem with it, I want to talk about what those problems can be, and it doesn't mean anyone did anything wrong, but let's talk about what can happen after you get a tattoo, and how do we resolve it. So first of all, if you've had a tattoo, let's hope that it's been done at a reputable tattoo parlor done by a professional, and they've sterilized everything, and I'm sure that you've sought out a reputable business to get your tattoo done. Don't ever do tattoo parties or amateur tattoos, because things have got to be sterile. But if you've had your tattoo done at a professional tattoo parlor where things are handled in a very professional, appropriate fashion, and I'm sure you've done that, you can still end up having problems, because even though they clean the skin before they tattoo, you still can't get the skin completely sterile. And so infections can happen with tattoos after they've been applied. But it's very uncommon, actually. But we see a number of patients who show up in our urgent care centers nationally, hours to days after having gotten a tattoo, and they're having problems or pain, and they're concerned about infection or a problem. And infections can happen, but fortunately, as I mentioned, they're uncommon. But another thing that can happen, a lot of people don't understand, is that you're actually putting the dye or the ink underneath the skin, and your body can have an allergic reaction to that dye, to the ink. And so a lot of people don't realize that, and they're forgetting that there's a foreign body, a foreign substance that's been injected underneath the skin, and your immune system and your body's going to react to that. And that can vary. Some people don't have any problems at all. Other people can have a very significant allergic reaction or immune response to the dye, to the ink, I should say. And so it's very important to remember that might not be all the inflammation or irritation or reaction you see to the area around the tattoo may not be an infection at all. It may just be an immunologic or allergic reaction to the ink. So no way to know if you're going to be allergic to something. People are allergic to any and everything in their environment. So there's no way you could have known that. And just because you've had one tattoo and done well with that particular ink doesn't mean if you have a second tattoo that the next ink that's used, whether it's different color, different manufacturer, etc., that you couldn't have an allergic reaction on a subsequent tattoo. So that can happen. So when we see patients with this, of course, the first thing we do is make sure that the tattoo was performed in a reputable tattoo parlor where sterile conditions were maintained and everything was autoclaved and all that stuff. And overwhelmingly, that's always, not always, but that's very, very frequently the case. These are professionals that do this, and it's a highly regulated industry. But then also, we will check and make sure there's not an infection, and we may even culture the area just to be on the safe side, make sure there's not an infection. And we may put the patient on an antibiotic just to be on the safe side again if there is some concern that this could possibly be an infection. But we also at the same time treat the immune response or an allergic reaction response. And we frequently find that patients do extremely well with this, and that can mean a topical or maybe an injectable or a steroid to take by mouth for a short period of time. That can mean antihistamine type medications such as Benadryl or Claritin, but also the H2 blockade drugs that are for stomach acid that also can help with an immune response allergic reaction, such as Pepcid is a common one. So taking antihistamine or using an antihistamine cream such as Benadryl, a topical petroleum-based antibiotic sometimes can be indicated, though not typically. Antibiotics to take by mouth, and even possibly a steroid to help cut down on the immune response to the ink. And again, this is a pretty common complaint we see in our urgent care centers nationally. and we approach the reaction with kind of a dual purpose. Could it be infection, or is it an immunologic allergic response? And taking that dual approach seems to take care of the overwhelming majority of patients' problems very, very quickly. So that's a little chat tonight about tattoos and complications that can arise after them. Hope that's useful for you, and look forward to see you again. I'm Dr. Jerry Williams with Urgent Care 24/7. Life is 24/7, and so are we.